So what were you doing in the UK? Well, there's a new trial. It's called the Transform trial, heavily backed by the NIHR and a great charity, Prostate Cancer UK, who have forked out to the tune of 42 million, largely led by at Imperial by Professor Ahmed, who I know very well. And this is a trial that is going to involve 300,000 men to be recruited. And if you get asked, I encourage you very strongly to try and join this trial. But unfortunately, you cannot put yourself forward for it. The recruitment is done via GP letters, which will be sent out to you. And the government is placing its backing, behind this trial to answer this question. What it basically involves is men between the ages of 50 and 74 to be screened. Now, you will see there the PSA readings. And there are three categories. There's a PSA of anybody with a PSA of 1, which we would normally regard as completely normal. Anybody with a PSA of 3, which we would regard as borderline. And then a third group where it really doesn't matter what your PSA is, you're going to be screened. Okay. And then there's polygenic risk scores that are being added to that. All of these men, regardless of their PSA, will have what's called a fast MRI or a biparametric MRI, which now seems to be in vogue. It's easier to perform, maybe doesn't give quite the same information as a multiparametric MRI, which we are very keen on, and then targeted biopsies. Now, this particular trial is very different to the trials that have gone on in America and in Europe. Why? Basically because we're using things beyond PSA. And one of the key criticisms of those two very large studies is that they only use PSA as a screening tool. And PSA as a screening tool does not fit the criteria for a national screening program. And it's on that basis that the UK National Screening Committee has been making these decisions. So just to summarize, that the topic is complicated, and one has to balance between the benefits and the harms of screening. There is a condition called overdiagnosis, which can lead to overtreatment if you actually diagnose more people than would have needed treatment. And that's one of the problems with a screening program. And like I said, those two very large studies used PSA as a cornerstone, and that has its limitations. They did not use MRI as it is used today. And they certainly did not use targeted transperineal biopsies. Most of them use transrectal biopsies. Again, we know that our diagnostics have improved greatly by incorporating MRI in the pathway and the targeted transperineal biopsies. So I've mentioned overdiagnosis, overtreatment, and of course, anxiety. It's very anxiety creating for men and their families. If somebody is undergoing prostate cancer screening and prostate cancer diagnosis and then prostate cancer treatment. But we do have more information now about how cancers behave and different grades of cancers behave. What's happened in the UK recently, you may have heard, it was all across the news, that the UK National Screening Committee, which screens for many conditions inside the UK, not just cancer, recommended against screening, apart from a very small group of men who have a genetic mutation. That was obviously not received very well, and a letter has gone into Wes Streeting from at least 120 MPs. So the final decision has to be made by Wes Streeting and the Department of Health, assuming he's still there. We all know that things change in politics, very, very quickly. And the actual consultation period finished on Friday, with a final report due, I think, at the end of March. And interestingly, the York Health Screening Consortium have criticised the UK National Screening Committee hugely. It was all in the papers, I think a day or two ago, saying that the risks of overdiagnosis had been overestimated, and that they had included studies where black men had not been represented. They quoted one study of 200,000 men, and only 89 of those men were black. So therefore, again, they're arguing that you have not looked at the right thing. And they used a rather damning term, which is the fact that the UK National Screening Committee was using yesterday's medicine to come to their judgment. But like I said, the final decision is yet to be made, but we expect, the backing to be behind the Transform trial.